Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. Today's lecture is something very like a mystery, yeah? MYSTERI. गूढ़ कुछ बातें हम आज करने वाले हैं, कुछ गूढ़ है. That means it is something like a more than the normal our lectures. So this lecture is a specific lecture related with some invisible things that can affect the children health. And Ayurveda says that those group of the diseases is called as Balgraha. So this lecture is for the Balrog or Kaumarbhritya tantra of the BMS students, but as well as for all the fathers and mothers, they try to note down this something metaphysical type of aspect of Ayurveda. Metaphysical type of aspect. That means in Ayurveda, always we give the importance to the Vata, Pitta, Kapha at a physical level, Sattva, Raja, Tama. At the psychological level, especially Raja and Tama, they can be a little bit disturbed. But there are also Ayurveda gives the importance to microorganisms and all these things. But this particular Graha word, like for example in astrology, you might have been heard about the what you can say, the Rahu, Ketu, Shani, Mangala, Buddha, Graha. So similarly, Ayurveda has also talked about these influence of the outside grahas or invisible matters on the health of the child. So let us see what Ayurveda wants to tell you about these things. Okay. So these I have divided into two parts. Today is a part one. Next week it will be the part two. So let us concentrate what is exactly the Ayurveda is talking about this word Balagraha. Okay. So the term Graha, what is this term? A lot of mystery is there. गूढ़ बातें हैं, ये सब मिस्ट्री है. अब तक उसके बारे में ज्यादा रिसर्च नहीं हुआ है, अनफॉर्चुनेटली. So I appeal to all the colleges, all the professors in the department of Kaumarbhritya tantra, maybe UG and PG. My request to all the head of the departments, HOD, professors, lecturers, assistant professors, associate professors, and especially the students who are doing MD, Doctor of Medicine, in the subject Kaumarbhritya Tantra. Please, my dear friends, take this subject as a part of research, because unfortunately very few documentation is available with relation to the Balagraha. There are hundreds of research papers on the topic of bronchial asthma in children, then jaundice in the children, epilepsy in the children, febrile convulsions in the children, lot of information of the physical and psychological autism, ADHD, attention deficit hyperactive disorder. Lot of research papers and researches are available on the internet, but very few about this topic, Balagraha management of Ayurveda and Balagraha type of the understanding. So I request all my MD students, PG scholars and professors to take this topic. This is a virgin topic of research. You just enter, try to find out the different things and make a documentation. I know that it is very difficult to perform this research, very difficult. But still I want to appeal. Let us try. Why not to try? Maybe with collaboration with the modern pediatricians. So let us think about it. Okay. Grahanat graha uchyate iti uchyate. Dallan Sushruta critics, he has mentioned the definition. Grahanat graha iti uchyate. The one, what is graha? Which captures. Try to understand my hands, which captures or seizes. Take out your physiology, take out your normal things from the body and make you ill, make you diseased. So that particular element, that particular microorganisms in the environment, invisible things in the environment, they all can be considered in the word graha. Okay, which seizes, which captures. And what they do by capturing the child, they take out. Seizes means to take out the physiology, and they start the crying. The children are starting crying. Let us see the definition. of this particular Balgraha. I will mark this portion for you. We can concentrate over here and let us start the discussion. The grahas are unknown factors. They are not 100% this. Streptococci, staphylococci, Mycobacterium tubercle, Mycobacterium leprae. No. Still, they have not found exactly the stamping of that particular anything. So, previously, it was totally unknown. Now, slowly, we consider it as a infectious thing. Suddenly, this particular ancient time, it is supposed that these invisible things suddenly and negatively affect the health and the well-being of the child, that can cause many health problems, many diseases in the children. The definition of graha is general impression of both psychiatric problems as well as acute physical disease manifestations. But the context of Kaumarbhritya is most of the grahas are physical type of the diseases. When you go, we will see the symptoms of each graha badha, affection with the graha, and most symptoms are physical level. Physical level, try to understand. Now, let us see the more factors about related with the concept of graha. Bhuta Vidya and Graha Chikitsa, these are used as a synonym. Bhuta Vidya means Graha Chikitsa and Graha Chikitsa means Bhuta Vidya. This is the one of the 8 branch of Ayurveda, which is called as a Ashtanga Ayurveda. 8 branches, super specialties. Kaya, Bal, Graha, Urdhvanga, Shalya, Danshtra, Jara, and Vrushan. These are the 8 branches of Ayurveda. Kaya, Bala, Graha, Urdhvanga, Shalya, Danshtra, Jara, Vrushan. Yeah, wait. Sir, Sanskrit? No, I am telling you the translation. Kaya Chikitsa, internal medicine. Bala Chikitsa, pediatrics, children. Graha Chikitsa, psychiatric problems and infectious problems. Because microorganisms are invisible. Kaya Bala Graha, Urdhvanga, Urdhva Anga, the part above the clavicle. That is ear, nose, throat, and brain. That is Urdhvanga. Shalya, surgery. Danshtra, toxicology. Jara, geriatrics. Vrushana, sexology. So these are the 8 branches of Ayurveda, Ashtanga Ayurveda. Okay. This branch mostly deals with the psychiatric illness, Balagraha, and personality disorders, psychological problems. The term Graha used in the definition of Kaumarbhritya should not be confused with the Bhuta. This is something different. Majority of the grahas in Kaumarbhritya Tantra giving you the physical problems. Physical, diarrhea, breathlessness, fever, all the physical problems are there, not only psychological. Let us move further. Graha samuthanam cha vyadhinam upashamanartham sushrut sutrasthan 1/5. Okay. Mostly breast-fed babies are affected by grahas. That means after delivery, first 6 months are very critical. You have to take most care for the first 6 months after birth, because that time the breastfeeding is going on. The synonyms of grahas explained: Bal Graha Pratishedha Adhyay in Sushrut. Bal Graha Pratishedha. Adhyay, chapters. Pratished means how to manage that Balagraha. This strictly confines to the somatic features, physical problems. Hence, the duty of a pediatrician is to treat these physical symptoms and not the psychiatric disorders. Here in Kaumarbhritya Tantra, in this Balagraha, we have to give maximum treatment for physical problems. Although chapter deals with the physical features, it begins with the story of mythology. I will tell that story afterwards. But there is a interesting story mentioned in the previous granthas. First sign of each graha, whatever the Balagraha 12 or 20 numbers, but in each and every Balagraha problem, I request all the students, please write down two important features. There must be fever. Fever, F-E-V-E-R, jwar, pyrexia, thermometer, normal 98.5 degrees Fahrenheit. It may be 100, it may be 99, it may be 101, it may be 102. And second, continuous and excessively crying. So fever and crying is common in each Balagraha. Don't forget to write down these symptoms. Fever and excessive crying. Please write down immediately. Okay. Fate of the disease. Why there is a problem with this Balagraha, fate of the disease? Here. Graha affects an individual with the help of supernatural powers with the three intention. What exactly the Graha wants? They want himsa, death of the child. Disease which finally results is to death, that is fatal somatic disease. So all these diseases, Balagraha, are serious problems. Number two, Rati, that means the coitus. But here you can take even the desire, the disease in which the patient shows excessive interest in the sexual act, that is psychiatric disorder. To disturb psychologically, to a child, to a person. So these are the intentions of the Graha, either to kill that person or to get a psychiatric problem with him, and Archana, worship. These Graha want that the Grahas should be worshipped by the child, by the person who has been affected by Grahas. They should worship Shani, Shanichi puja karaichi, worship the Shani Graha, worship the Mangala Graha. So this worship the Buddha Graha, because there is a problem with the Buddha. So this worshipping, the Graha wants to get worship for themselves. Okay. So this is a patient will be relieved from the disease, that these all the things are self-limiting disorders, or basically here. Actually, one thing I request all of you to note and also write down if you want. Three types of management in Ayurveda. Please write down 3 types of management. All the chikitsa treatments are categorized in the 3 parts. Three, write down. Number 1, please write down everybody. Yukti Vyapashraya Chikitsa. Yukti Vyapashraya Chikitsa. What is that? Regular, you go to the family doctor, he examines you, then he gives some tablet, kadha, decoction, asava, arishtas, bhasma, etc. etc. He thinks logically. Nidana pancha panchak. What are the causes? What are the purva rupa, upashaya, anupashaya, samprapti? And then he makes a provisional diagnosis. Sometimes he may ask investigations, then confirm diagnosis, and okay, these are the vata is disturbed, pitta is disturbed, okay. They have attacked on the rakta dhatu, okay. So he logically everything has been fixed in the mind of the doctor, and he treats you. So logical thinking and treating is yukti vyapashraya. Okay. Then daiva vyapashraya, second, daiva vyapashraya chikitsa. Daiva vyapashraya chikitsa, like a spiritual treatments, adhyatmika, spiritual type of treatments. For example, Om Namah Shivaya, Om Namah Shivaya, Om Namah Shivaya, Om Namah Shivaya, or Om, chanting of mantras, making the yajna, huh? Then putting some garlands over here, mala dharana, Okay, so all these things, worshipping, chanting of mantras, sometimes bali, sacrificing something. So this particular, all the things, apart from the your yukti vyapashray, these are categorized as a daiva vyapashray chikitsa. And last, third, sattva vajaya. Please write down. Sattva vajaya. We have to build up, maintain the sattva guna of the mind. Sattva is always positive. Rajatama can be positive, can be negative. So they are little bit prone to imbalance. So you have to be stability, tranquility is with the sattva guna. That is called as a sattva vajaya chikitsa. So which three treatments Dr. Deshpande has mentioned about Ayurveda? Come on, tell me. Yukti Vyapashray, that Ayurveda Academy is doing Yukti Vyapashray. But yes, Ayurveda Academy also doing Daiva Vyapashray. Ayurveda Academy also can do the Sattva Vajay. Because Dr. Deshpande is having a good team of the physicians, surgeons, gynecologists, pediatrics, astrologers and palmists. Yes. In Ayurveda Academy, we have astrologers and palmists. If you want the paid consultation of astrology and palmistry, WhatsApp 9226810630. That comes here, Daiva Vyapashray Chikitsa, based on astrological chart, based on your lifeline, headline, heartline, etc. Okay? Anyway, coming to the point, one of these particular rati coitus is not applicable in the children because none of the grahas explained in the ancient text showed the features of sexual affinity. So graha badha ends either in the psychological trauma or bad luck, death, or third option is get cured by the treatment. So three things can happen with this balagraha. Unfortunately, the child can die. It can be get totally cured, or it may get some psychological problems. Now, let us see the number of grahas. Only the red line marking are very important. Now I have started this new technique. I have got this technical underline important things so that the students, the viewers, they concentrate on this topic. So Ashtanga Hridaya and Yoga Ratnakar, there is a mention of 12 grahas, graha badha, balagraha, and Sushruta has mentioned 9 and Kashyapa Samhita 20. Vagbhata, Ashtanga Hridaya is written by Vagbhata. 12 grahas, while Sushruta explains only 9 grahas and classified according to the Linga Bheda. Linga means gender, male graha, female graha. Okay. Now we will go further. First, we will try to see the names of Purusha Graha. Do you understand? In each lecture, Dr. Deshpande is giving some examples of MCQ, multiple choice question, for AIAPGET, All India Entrance for PG Examination, MD and MS. If you want to get admission after BMS, you must remember what Dr. Deshpande is telling. There they have given, for example, they can ask Shvagraham. What is it? Is it a Purusha Graha? Is it a Stri Graha? Is it a Purusha Stri Graha or nothing? So you have to tell that Shvagraha is a Purusha Graha. So these are the only names. You have to remember names as it is. So my dear friends, first we will concentrate on Purusha Graha. Male gender. Skandha Graha, Skandhapasmara and Pitru Graha. These are Purusha Graha. Skandha, Skandhapasmara and Pitru. In the Vagbhat, Skandha, Skandhapasmara, they are same. Pitru is the same. Only the new thing is, what is the new thing? Mesha Graha and Shvagraha. You have to remember, Shva means dog and Mesha is like a goat. Bokad. So this Mesha and Shva, these extra name, but otherwise Skandha, Skandhapasmar and Pitru all are same in Sushrut and Vagbhat. Purusha Graha. They are very strong. Then Stri Graha. Can you see? Stri Graha. Shakuni, Putana, Shita Putana, Andha Putana, Mukha Manditika, Revati. I am very sorry, my dear friend, there is no, I think, very proper short form or the mnemonics, but you can create by yourself. If possible, I will also try to make some mnemonics from these names. Just one sentence, how you can see. For example, Shapushi Amure. Shapushi Amure. You can make this type of sentence. This is called as a mnemonics or the tricks how to remember. Shapushi. Shapushi Amure. Shapushi Amure. Funny name you can prepare. Shakuni, Putana, Shita Putana, Andha Putana, Mukhamanditika, and Revati. Here you can see Shakuni is the same, Putana is the same, Shita Putana same, Andha Putana same, Revati is same, Mukhamanditika is same, only the extra is a Shishka Revati. So it is very easy to write in the examination. One list is Sushruta, one list is Vak, but most grahas are same, only one or two. In addition, you have to remember. Okay, here addition is a Mesh and Shva, Purusham, and here in the ladies there is a Shushka Revati is extra than the Sushruta. So first column was Sushrut, another was Vagbhat, Ashtanga Hridaya. Now, next part is, we are talking about Balgraha, Purva Rupa, warning signals. Purva Rupa, warning signals. Tesham Grahishyatam Rupam Pratatam Rodanam Jwaraha. Pratatam Rodanam Jwaraha. Ashtanga Hridaya Uttar Tantra 3/3. This is the reference. Ashtanga Hridaya Uttar Tantra. Pratatam Rodanam. Continuous crying. Rodana means crying and fever. Satatam Rodanam Jwaraha. Don't forget this line. All the time you have to write down. Upon affliction with the graha, acute fever manifesting in an apparently healthy child, that means till the afternoon the child was very playing and happy, and all of a sudden at 5 p.m. he gets a high fever, 102, 101, automatic, and starts crying, non-stop crying. So that you can understand it may be some, because there is no cough, there is nothing, loose motion, nothing other symptoms are there, only fever and crying. So this can be, according to Ayurveda, Balgraha. Child prompting it to cry constantly, this has to be considered as a warning signal. I don't say it's a fatal, but it's a warning signal. You have to take care what is exactly the problem. Now, next is the Lakshana. That is, after Purva Rupa, you get the Rupa. Rupa means Lakshana. Okay? This is a Vyaktavastha. Everything is being clear. The symptoms become clearer. Samanya Rupam. Samanya Rupam. What is that? Jrumbha. Yawning. Then there is no sleep. Painful disease and discomfort is there. Prajagara. Prajagara means no sleep. Prajagara. Always keeping. Then aversion to the breastfeeding. Loss of appetite. Twitches, convulsions, that is febrile convulsions, and froth from the mouth. So here you can see Rodanam, Kujanam, Stanya Vidveshaha. Don't want to drink. So the child will not drink the breast milk. Swarvaikrutam. Okay. So all these symptoms are the symptoms of Balgraha. Let us move further. We are seeing the symptoms of Balgraha. So I will mark for you. Yes, it is already marked. So, Rodana, crying, Pujanam, Swara Vikruta. The voice will be a little bit different. Grasping to the mother due to the pain. The child will start getting severe pain. In the postnatal period, if an infant presents the fever, excessive cry, and later on with the convulsions, the usual condition is an infection. This is should be the diagnosis. Further symptoms are to be looked for locating the site of infection. So doctor's duty is to find out where is the infection. He can examine the ear, whether there is a discharge, otitis media. He can see here whether there is a redness, rhinitis problem is there. He can look to the mouth, tonsillitis or stomatitis or whatsoever. Then he should auscultate the chest, whether there is any sounds, ras, bronchi, pneumonia. Then he has to examine the abdomen. Is there any tenderness, any tumor? So all these things he has to start to investigate where is infection, the focus of infection. The treatment for affliction with the graha is mainly, please write down this word. This is most important for Balgraha. Daiva Vyapashraya Chikitsa. Professor Deshpande has already mentioned 3 names of the management. Yukti Vyapashraya, Daiva Vyapashraya, Sattva Vajaya. Psychological counseling, Sattva Vajaya. Yukti Vyapashraya, logical inference of the diagnosis and treatment by the family doctor or the consultants. And here, although the word is not very proper, but mantric and tantric, they can do this type of Daiva Vyapashraya Chikitsa. But one should not keep the blind faith. Andhashraddha, I am opposite to the Andhashraddha. Blind faith is always dangerous. For example, in the village places, rural places, slum areas, illiterate people are there, and some bhondu, cheater, fake doctor is there, faith, Dadiwale Baba, with the beard and mustache and all the different type of clothes and lot of garlands. Oh, come on, my child, I will cure this. Bring some chicken, kill that animal, and then he will get cured from his fever and he will stop crying. Don't keep the blind faith. Whenever you get this type of even Balgraha problem, you visit to the authentic, registered medical practitioner, registered medical doctor only. No blind faith. अंधश्रद्धा रखनी नहीं चाहिए. ये मेरा संदेश है जब मैं बालग्रह की बात कर रहा हूं. Professor Deshpande is talking authentically. He is not supporting any cheaters, any fraud people. No. Bua, Baba, Sadhu. No. Never. Go to the official PHC, primary health centers. Go to the government hospitals. Visit to the doctors, and whatever they will say, do the X-ray, do it X-ray. If they want the ultrasonography, do it ultrasonography. Because in the government hospital, everything is free. So, if anybody is teaching like that do some Daiva Vyapashraya means giving the sacrifice of the animal and all these things. No, don't give the faith much on these factors. Okay. All the other diseases explained in Ayurvedic classics are chronic or acute on chronic. That means some chronicity is there and exacerbation is there. More attack is coming. They have a definite progressive pathology. But Graha, these are a little bit different classification, possess an acute onset as well as very fast progression. Besides the Nidana, that means causes, Samprapti and Dosha Avastha are not properly explained in the previous text. The main systems affected by Balgraha are the nervous system, brain will be affected, gastrointestinal tract, loose motions will start, vomiting may occur, and respiratory system, cough will be there, breathlessness will be there. Then confusion will be there, unconsciousness may be there, there may be delirium may be there, fainting attacks may be there. Are you getting my point? Some motor and sensory system problems will be there. So this is something, these 3 things we have to take care of. Now, my dear friends, we are starting with the specific one graha affection after another, step by step. We are not going fast. We have the second lecture also of the Balgraha. There we will complete the remaining thing. Okay. So this is Skanda graha. Can you see? I will mark for you. Don't worry. Just give me a few minutes. Skanda graha. Ashtanga Hridaya Uttara Tantra. Vagbhat. The most examples are, there will be stabdhang, stiffness will be there. Okay. Dant Khadi, like that. Stanat dveshi, do not want to drink the breast milk. Roditi, 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 crying, crying and crying. Vaktra, vaktra, vaktro, facial paralysis. Vaktra, vakto. Okay. Vamana, vomiting may be there. Lala bhrisham, saliva will be more. Okay. Let us see the English translation. So there will be first watering of one eye. There will be excessive lacrimation. Then unsteady head, like all the time the child will move his head. Unsteady head. Okay. Hemiplegia, the weakness of the right hand, right leg, or weakness of the left hand, left leg. Half body will be paralyzed. Okay. Then hypertonicity of the muscle. The muscles will be stiff. If you feel normal, it should be elastic. It is called as a muscle tone. It will become more hard. Hypertonia is a feature of upper motor neuron disease according to nervous system. Excessive sweating will be there. Drooping of the head like that. All the time it's bent down. Lethargy. The child will not play all the time. He will not respond to the family talking. No. Aversion to the breast milk. Next symptoms. Aversion to the breast milk. Excessive crying. You write this thing everywhere. Excessive crying. Facial palsy. Just now I have mentioned. Vomiting. Rolling up of eyeball and clenching the palm like this. Clenching the palm. So these are the features of first Balgraha, that is Skanda Graha. Okay, let us move further. Skanda Graha. Skanda Graha. Huh? Reddish, red eyes will be there. Excessive engorgement of the blood vessels. Every Graha, any 12 or 20 Grahas, there will be fever. There will be excessive crying. The clinical profile of each graha should be read in connection with this particular statement. So in each graha badha, fever and cry, you must write. Okay. Here in the Skanda graha, rigidity, stambha, facial palsy, that is vaktrata, hemiplegia, okay, vomiting, that is vamana, clenching of palm, baddha mushti, and neck rigidity, shirovikshipate. Indicates the affected area is nothing but the brain or meninges. All these symptoms are indicative of meningitis of infectious origin. So my dear friends, you are requested to write down the comparison of this particular graha vada. Skanda graha is equal to or similar, not equal to, but parallel to meningitis. Skanda graha, meningitis. Skanda graha, meningitis. Skanda graha, meningitis. Skanda graha, meningitis. You make a table. You make a table of on one side name of the 12 grahas or name of the 20 grahas, and here if it is some parallel concept is there, write down that concept. So Skanda graha, meningitis. Skanda graha, meningitis. Okay. This is Mastishka, Avarana, Shof, that is Shoth, edema. Meningitis, ITIS is always inflammation. This is the inflammation of the covering of the brain. Inflammation of the brain parenchyma inside is known as encephalitis. Meningitis is different, only covering. Encephalitis inside the cell. Although traditionally this is called as meningitis, there is always a combination of meningitis and encephalitis that together is called as meningoencephalitis. Okay? Clinical presentation. Classical symptoms are fever, high fever will be there, headache, severe headache will be there, and projectile vomiting will be there. That vomit material will come forward on a long distance. It will fall on the long distance, not here. That is called as a projectile vomiting. Projectile vomiting. Meningitis, specialty. Okay. Suspect meningitis in febrile child if the child has any of the following another features. Undue irritability, always crying and drowsiness, like always like sleeping, always sleepy, drowsiness, for which there is no specific reason. Signs of meningeal irritation, like for example, nuchal or the neck rigidity, positive Kernick sign, Brudzinskis sign. Here again, I remember to tell you, what to tell you? Whenever clinical examination word, anybody will say to you, do you know clinical examination of digestive system, clinical examination of respiratory system, clinical examination of CVS, clinical examination of nervous system, clinical examination, PV examination, child examination? Then tell him, Professor Deshpande has mobile app also in addition to YouTube channel for the health propagation, health knowledge sharing. Mobile app name is Ayurveda Academy, available on Google Play Store, certified 100% what you can say, the seal proof best app, mobile app, smartphone, Android, and free download. So please download, at least download, then check nearly 12 to 13 programs. And there are PPTs are there, PDF are there, audio is there, video is there. Why not to take advantage if they are very, very cheap? Only 200, 300, 400, not in thousands, not in thousands. All other, you can see 5,000 fees, 10,000 fees, 20,000 fees. No, no, no. Only hundreds. Dr. Deshpande wants that knowledge should be shared to the maximum people. So these Kernick sign, Brudzinski sign, everything has been shown in the nervous system examination. Okay, neck rigidity, plantar reflex, it is shown. Seizures, convulsions will be there. Bulging fontanelle here, bulging fontanelle in small infants. Now, which are the organisms responsible for meningitis? There may be some bacteria like H. influenza, pneumococci for meningitis, meningococci for meningitis, E. coli giving meningitis, and other, maybe sometimes gram negative enteric bacilli. Group B streptococci, enterococci, all can cause meningitis. Okay, viruses, enterovirus, mumps, and herpes simplex virus. Sometimes even fungus in immunocompromised and hospitalized patient. Sir, 1 minute. So what is that immunocompromised? What is that immunocompromised? That means the patient having immunity very, very low. For example, HIV or the AIDS. There may be autoimmune diseases. There may be chronic kidney problem like the nephrotic syndrome, and patient is on steroid. So the patients are called as a immunocompromised. Their immunity is very, very unstable and weak. So anything can attack on them, bacteria, viruses, fungi. Okay. So in short, now I will request you write down this important statement. The lakshanas of Skanda Graha resemble most of the features like acute bacterial meningitis. Skanda Graha, acute bacterial meningitis. Okay, next. Skandapasmar. Next is a second Balagraha. We will discuss nearly 12. Ashtangaruday Uttar Tantra, always don't forget the reference. Ashtangaruday Uttar Tantra, chapter number 3. Skandha Apasmara Lakshanam, Skandapasmara Lakshanam. First is a Saudnyanasha. Then Shakrit Mutra Pravartanam. Then I am only telling you the important Saramba Jvara Jagara, Puya Shonita Gandhascha. Smell, most of the time, smell is explained in many Balagrahas. Smell, don't forget smell. Okay. So what are the symptoms of Skanda Apasmara? Here you can see occasional loss of sensorium, in between unconsciousness, fainting, pulling of the hair because of the pain is there, drooping of the head, opisthotonus, frequent yawning because oxygen is coming less oxygen is entering, simultaneous fecal and urinary discharge, froth discharge, rolling up of eyes. Can you see here underlined? Then tics or convulsions of the hands and legs, biting of tongue whenever there is a convulsion, then fever, sleeplessness, smell of pus and blood. Smell of pus and blood. So, here modern comparison. Features of Skandhapasmar. Features of Skandhapasmar are similar to the febrile convulsion. Febrile convulsion. Skandhapasmar, febrile convulsion. Skandhapasmar, Write. Why don't you write? Skandhapasmar, febrile convulsion. Skandhapasmar, febrile convulsion. Let us talk about febrile convulsion. The convulsions in a baby occurring when the child has fever of 38 degrees centigrade or above and without the evidence of documented CNS infections. There is no CNS, no meningitis, but still convulsions only because of the fever. This is one of the commonest cause of fevers convulsions in the children. Convulsions are also called as seizures. Epilepsy is one of the diseases where convulsions are there. Febrile seizures or convulsions are age dependent. Whichever underlined, you can fastly write it down. Start writing. These are the most important points which are mentioned red line. Huh? So this is febrile convulsion is rare before 9 months and after the age of 5 years. So only in between the 9 months to 5 years, there may be chances of fever and convulsions. The peak age where the maximum febrile convulsion can occur, that is 14 to 18 months of age. But usually one more interesting thing I would like to tell you, because modern pediatricians, are always testing the knowledge of these Ayurveda students. So one interesting thing I would like to tell you that febrile convulsions is occurring in the child's life only 1 or 2 times, not more than that. This is not like that each fever time the child will get the convulsion. No, not at all. Not at all. So remember this important point. Genetic predisposition is common and history of the same should be inquired in the family history, that is siblings and the parents, whether they had any type of in the relation they have febrile convulsion history. We will go further. Now we are talking about the febrile convulsion clinical features. So here are the febrile convulsions clinical features. I think today is a Ganesha Chaturthi, and in my colony, Kapila Society, Pune, in the ground we have the Ganpati temple, and there I am hearing, I don't know whether you are hearing, but there is a priest, Pujari is there, and he has started the puja, worshipping of the god Ganesha. So I am sorry if you are hearing some sounds. Ankit, are you hearing any outside sound with me?
No, sir.
Okay, good. That's good. My mic is good then. Thanks to the mic, because it is masking the outside sounds. That's fine. So febrile convulsions, the simple and typical features, 75% of the patient they may suffer. That means if you take the survey of 100 child having the fever, only 75% can get these convulsions, not 100%. Generalized tonic and clonic or tonic clonic. What is tonic clonic, sir? Convulsion, stiffness. Convulsion, stiffness. Convulsion, stiffness. That is tonic and clonic. This type of alternate going on. Even for the legs, even for the hands, everywhere. Okay. Last for less than 15 minutes. If any convulsion This is also a big time, only 5 it stops. Usually my experience is not more than 5 minutes. 15 minutes is never we see the convulsion. Unless and until you don't treat the fever, it can continue more time. But if there is a simultaneous cold sponging is going on, if you are giving Ayurvedic medicines or modern medicines, then it will be definitely coming down. These convulsions will not longer. Immediate recovery of sensorium. Whenever the convulsion stops, immediately, if you ask, baby, hello, hello, he will look towards you and respond to you. No residual neurological deficit. No, no, no. You will think that he may get paralysis or hand drop, foot drop. Nothing will happen. Nothing will happen. Don't worry, be happy. It is not like epilepsy. Yeah? No, no, not that much serious. It's very casual. Very casual. Only in any fever, I will request to all the parents who are seeing this video, if you want that your child should not get the febrile convulsions, do some simple home remedy or the things that will protect your child from febrile convulsion. You try to see that fever should not go up. One of the commonest mistake that I see many times in my practice, that the illiterate people, village people, slum area people, poor people, they don't know the knowledge. And what they do when the child is having fever and they feel that the child is getting cold, they wrap the child. They wrap the child with the blankets and the towels and the chadar, they wrap the top, and the fever goes on increasing. So whenever I take these patients in my clinic, I just request them, because we have to request the family, they request them to take out this blanket, take out this chadar. No necessary. I am here. Don't worry about your child's fever. I will take care. First, remove all the blankets, chadar, shawl, even the shirts and pants. Remove. For the children, you should remove maximum and expose him to the weather. Especially you start the fans. Fans. Give him cold. Cold sponging is important. At least room temperature water. Take in a tub some water. Take some towels, that is napkins. 2 napkins. One is a dry, one is a wet. Take squeeze out that water and all the start wiping out with the water. Water that what I said right now, your napkins, and then immediately dry it. Wipe with the water and immediate dry. That is called as sponging. So cold water sponging is the best treatment for any fever. Only putting that patya, lavana jala or water or the ice. But better way, you remove the cloths and totally from head to toe, always wipe out with the water and dry it out. This is the best method to reduce the fever and to prevent febrile convulsions. Skandapasmar, Balgraha treatment. Okay? Because this is very essential, this knowledge. Nobody knows. We taken into granted, this is a simple thing, doctor, you are telling. Yes, but these things are not following by the society. So take care. Okay. Now, complex and atypical, what will be there? So these are very rare cases, but 25% may be there like this. Focal in onset, last for more than 15 minutes, prolonged unconsciousness may be seen, residual neurological deficit may be present, weakness of the hands for few further days. Here, the akshepaka, that is convulsions in association with jvara, can be seen in many different styles or different ways. Okay, so jvara anubandha akshepakam, jvara anubandha akshepaka. Akshepaka is a convulsion. So always try to remember Ayurvedic terminology also. My dear friend, this is the beginning of the Balgraha chapter. This is not the end. So next time we will continue, but still we have the 3-4 minutes in our hand. So just few audio information. Physical diseases, sharirika vyadhi, are basically because of the vata, pitta, kapha, dushti, or the prakopa. This particular dosha dushti is of 2 types. Nija, internal causes, and Agantu, that is external causes. Nija and Agantu. Okay? Nija Dushti, many diseases that you can see, like Shwasa, Atisar, etc. Agantu problems, in Agantu problems, one of the problem is Balagraha. So Balagraha is a Agantu problem. Please write down. There are two types of diseases, Nija Vyadhi, Agantu Vyadhi. So Balagraha is always Agantu Vyadhi. Balagrahajanya Vyadhi. There are two types of the symptoms. Some are more 95% physical and some manasik lakshanas are also there, psychological things. But very rarely, dosha vaishamya is not the beginning of the disease. Dosha vaishamya is not beginning. It can come afterwards. So, agantu karana, agantu causes are more important in this balagraha. Balagraha, they have mentioned the different yoni, that is creative factor of the disease. Yoni is a creative factor. Okay? In Balagraha treatment, there is not much a description about Shodhana Chikitsa or Shamana medicines. But there, only symptomatic treatment has been mentioned. Lakshanika Chikitsa, symptomatic treatment as mentioned. Then, to satisfy this particular, the things of Adrushya Yoni, Adrushya Yoni Atma, to satisfy this Adrushya Yoni Atma, because they have the, as already mentioned, they have the intention of Rati, Himsa, and Archana. So, Ayurveda has mentioned about the Bali Chikitsa, sacrifice of something, Annadana, donate the food, and some, what you can say, the mythological type of the things are mentioned in the treatment part. I will tell you the small story and then we will stop today. Balagraha Pauranika story, Pauranika Katha, mythological story. Please hear carefully. Shankara, Bhagwan Shankara, Bhagwan, God Bhagwan. Shankara, Shankara is a Parmeshwara. Shankara Putra, the son of the Shankara, was the name Shadanana. Shadanana. Shadanana is the name of the son of the Shankara. And Shankar has deputed some servants, gent servants and lady servants, to protect this child. But then when the child grown up, then these bodyguards, they don't have any duties. So they, bodyguards, servants, they go to the Bhagwan Shankar and they say, see, Bhagwan, now we don't have any duty because this Shadanana or Kumar Kartik has grown up. He is very intelligent and he can take care of his own. So what we can do, we don't have any duties now. And you are just giving us the salary, what to do? Then Shankar has ordered, yes, I have another job for you. I have another job for you. What you do? You go on the earth and check out whether there is any uncleanliness, unhygienic, then misconduct, adharmikata is there, apavitrata is there, aswachhata is there. The people who are doing non-religious things, non-ethical things, they are not following the code of conduct of cleanliness, they are not maintaining the hygiene, you attack on them. The servant should attack on these people. So, for this bad conduct, trouble them and make them punish by fever and by some infection. And then you can get some return. They can do some spiritual things, they can do some medicinal things, but let them work for their survival. So, this is a small story. Forget about the mythological part, but what is the essence of the story? That Bhagwan Shankar has given, ordered his servants to attack on the people who are unethical, and who are not following the code of conduct, सदवृत्त जो पालन नहीं कर रहे हैं, जो अस्वच्छता लगातार बनाए रखते हैं, प्रॉपर केयर नहीं करते हाइजीन का, उनके ऊपर अटैक करने के लिए बोला है. मतलब we easily understand this is nothing but the infections that we get because of our stress, mental stress, our unhygienic things, eating outside in the roadside food and all these things. So all these things are having some sense of medicine also in these mythological stories. So my dear friends, thank you very much. Thanks a lot. Tomorrow we will continue with another subject, that is a Swastha Vritta in the evening from 7 to 8. Thank you very much. Take care and don't forget to subscribe my YouTube channel. Thank you very much.